My name is Nathan Lorenchuk. I'm a urologist and I'm the director of the E.J. Witten Prostate Cancer Research Centre at Epworth. How long have you been working with cancer patients? Well, I've been working with cancer patients probably for well over 20 years, and I find treating cancer patients probably the most rewarding aspect of my career and the work that I do. And it's wonderful to tell patients that they no longer have cancer. That's probably the best time we have as a urologist. What drew you into cancer treatment? I think I was drawn into cancer treatment for two reasons. One, because I feel it's a disease we can certainly have a huge impact on as urologists and surgeons. And secondly, the actual surgery and the way we treat patients is absolutely fascinating. But in the main, it's really the attraction to making a difference to patients where it really does count. How do you tell a patient they have cancer, and how difficult is that? I like to do it in person, obviously in a quiet environment and in a place they feel safe, comfortable, and generally with a partner or loved one with them, because to have a diagnosis of cancer is something that is life-altering. Although for many people in the field of urology, it's a large road bump, but not something that will completely derail them. So it's also important to give them a positive outcome as well as understanding the cancer diagnosis. So for me, it's not just about telling them what the diagnosis is, but also giving them a pathway forward and giving them hope. What's changed in treatment and survival rates in the last 20 years? I guess the biggest change in my career in the last 20 years has been the use of robotic surgery to do a lot of what we do, whether it's removing the prostate or part of a kidney. At Epworth, we were the first hospital in Australia to get robotic surgery way back in 2002. The other aspect is that we're also keeping patients with cancer alive a lot longer without necessarily curing them. So if we can't cure patients, our desire is to keep patients living for as long as they can with as good quality life as they can, and thus turning cancers not into death sentences, but in fact chronic diseases. What types of treatment options are available for your patients? Well, certainly at Epworth we have all treatment options available, but for me the best form of treatment for a lot of the cancers we diagnose is actually monitoring, or what we call active surveillance. For example, prostate cancer, the vast majority of that is just monitored and watched. And that is a safe thing to do, and it's safe to do when you have access to excellent tools. Are there new treatments available at Epworth that aren't yet widely available across Australia? The one thing that stands out that is available at Epworth is focal therapy for prostate cancer using a very specialised instrument called the NanoKnife. And what that aims to do is, instead of having a man have radical surgery or radical radiotherapy, what we're able to do is use technology using a PSMA PET scan, again through Epworth, where we focus in and find just that little part of the prostate that has cancer, and we go in and destroy just that part of the prostate. Is there one thing about your specialty that you think people would be surprised to hear? Most people are surprised to hear that most prostate cancer that's diagnosed in Australia these days is actually monitored and watched closely rather than having aggressive treatment. What are things that people should avoid to lower their risk of cancer? I say to patients, the first thing they should do is quit smoking. If they smoke, that will reduce their risk of a lot of cancers. In terms of prostate cancer, we have an expression that what's good for the heart is good for the prostate. So exercise, maintaining a healthy diet, a healthy weight. The rest, of course, is being vigilant and going to see your general practitioner so you are screened for these cancers so that they're picked up early. What are some of the embarrassing questions that patients ask? Certainly after treatments for prostate cancer, be it surgery or radiation, there can be some issues with sexual function. Most men haven't had long and convoluted conversations about erectile function, particularly with their partner present and a third person. Words like penile rehabilitation have come into use in prostate cancer treatment, as well as using sexual therapists and other practitioners that we would never have done 15 or 20 years ago. So I think really having open and frank discussions about sexual function, performance, as well as the anxieties, they're often the most challenging and embarrassing questions we're asked. What's the one piece of advice you would give someone who has cancer? Cancer is, in most instances, particularly in our field, not a death sentence. The word cancer can be a powerful word, but it has to be re-engineered as a word of hope and a word that shouldn't take away from them, but perhaps look forwards to giving something back once they get the appropriate treatment and they know and understand and have a team around them that can help them get through this difficult time.